Hi there, this is Dr. Bill White again with the American Orthodontic Society, and I wanted to talk about retention of cases. There's a lot of people, including a lot of orthodontists, that don't understand the full extent of retention. And if you take somebody who's got a closed bite when you start out, I mean the lower teeth are up here close and they lap over a great deal, and you treat this case, you have to open the bite up steadily, and then you do whatever's necessary to line it all up orthodontically, and you stop with it with a little bit of overjet and overbite so that the person can reach out here and bite a sandwich off, and his back teeth don't touch. He just touches here and he touches in the jaw joints back at the back, and you have everything doing it right like that. Then if you fail to retain it properly, this case can develop a TMJ problem, and let me explain why. I'm going to try to get on to the case, and maybe I can show you from the models better. Let me get back over here on my little star. And I've lost my, oh, here we go. I have to get back on this little pen. I guess you'll have to. All right. Now, let me get to a point. Now, they finished this young lady's teeth like this. Now, this was a reputable orthodontist who does good work usually, but the retention is not good. Now, these upper teeth right here lap over the lower teeth. The lower teeth come up to about here in this particular case. And preferably, I didn't see the case when it started, you just need about this much of overjet and overbite, about 1.5 millimeters or 2 millimeters like this. And then you put the retainer in the mouth and you put a bite plate that holds it that way. If you start off with a deep bite case, you level the bite and straighten everything up and stop and don't put something in here, this case will tend to close down again. And as it does, as it closes down, the lower teeth go up on the upper teeth, and it's on an incline, kind of like this. And it tends to force the lower teeth backwards, or back to forward. Now, they will, in retaining a case like that, they'll put a 3-to-3 retainer on the bottom teeth across here, from the cuspid to the cuspid. And this bar behind here won't let the lower teeth go back. And then you've got a retainer out here or something going across the front part of the mouth. And this won't let the upper teeth come forward. And now you can't, in other words, something stops you from the upper teeth coming forward, and something stops the lower teeth from going back, but nothing is there to stop it from closing down in this fashion. And so when it does close down, it slides back on this, and the people will finish their orthodontic case, and 2 or 3 weeks later, they come down with pain in the jaw joint. I went to a guy who specialized in jaw joint problems, and he was saying every case he showed up there was after orthodontics. And he said orthodontics creates a TMJ problem. And he did this on 3 or 4 cases he had there. But it wasn't the orthodontist, it was the way he retained it. In other words, if he had opened the bite and put a little bite rim up here of acrylic to stop the bite at that point, it would have never started. But he didn't. And now the case is going to tend to deepen. I don't care who you are. If you were deep bite diddly to start with and you finish the case, it's going to try to close back again. And that's what's happened in this young lady. And this was hurting. She went back to this. He was a good orthodontist. I knew him. Everything did good work, but he didn't understand this. And he said, well, the orthodontist, the orthodontic work doesn't have anything to do with the joint back here. That's what he was believing. And it definitely does have something to do. So as this young lady's bite closed to, the incline in the upper teeth, the back side of the upper teeth, caused the jaw to slide backwards, or pushed it backwards. And when it does, it takes the condyle back in here that's in the fossa and pushes it up against this retrodiscal tissue that we've talked so much about, and you can't put any pressure to speak of on that. It's highly vascular, it's got a lot of nerve endings, and it's where your synovial fluid is formed. And if you put too much pressure, it's making it hurting. It really hurts. And that's where much of our TMJ works comes. I knew this young lady's uncle or somebody in another place, and I had him go in and open this bite again and raise it up and open it up, and the minute he got it open, the pain went away, and he put a retainer on her that had a bite plate on it, and I think that's what we've got some pictures of that in here. Now, when you look at it again, I said the guy did beautiful work, but to me, this wasn't all that pretty. These teeth were off. Now, this, he did have one of the 6 keys occlusion, but the bite deepened. It should have been open, and the angle on these teeth is too steep. It doesn't have enough torque. They ought to be out here. So I told this Dr. Henry, said, just elevate these teeth and change the torque. In other words, if you just pick them up, that'll change the torque, and it'll give it room, and this jaw can come forward and keep these teeth down, put a bite plate on it where it can't deepen again, and she won't have any trouble with the TMJ. And that's exactly what happened on this case. And I don't mean to run anybody down on that, but this guy doesn't understand finishing an orthodontic case. Now, on the other side of the mouth, it's got better, it's fitting together much better, but it's still a deepen. And I'm going to go on and run through here. This is the upper teeth, this is the lower teeth, and that's the way it was biting together when they came in. And that's what I saw in this young lady. So I told him to go back. So I sent her back to her uncle, and he went in and redid this, and he picked these teeth up. These teeth were not down here, and you'll see the teeth were like that, and they torqued them out here. They gave them some room and brought these down, and now the jaw stays further to the front, and this condyle back here at the back doesn't mash on this retrodiscal tissue, and the pain goes away. And it's just that simple, but there's a lot of people don't understand that. Now, I've written an article on that, I've published it and things. People just don't keep up with it. They think that orthodontics has nothing to do with it. The orthodontist, Dix, was all right. I imagine the guy had it up high when he stopped, but he didn't put anything to keep it from deepening, and so the bite went down and it shoved the jaw back, and this young lady comes down with a TMJ problem. And that's what you have to do to to correct it. In other words, change the torque and intruded these teeth right here, and these teeth straightened out too and opened up, and now they have about the proper depth in here. She can bite a sandwich and the back teeth don't hit, but the load is here and back in here where the jaw joint is. So when you bite on your front teeth, you should not hit in the back. These teeth ought to clear. And if you hit here, you bite harder, and that messes up the thing, so you can have a problem with it. All right, I hope some people that are doing orthodontics will realize this, and I like to put a bite plate up in here on the cases when I get through with them. And you see these teeth are straightened out this way. They have more room in here, and the lower jaw is not being pushed back in this direction, and that keeps the condyle off of this retrodiscal tissue, and this pain stops. Let me go back here and erase that. And this is the lower thing. And now we've got it finished up, and she's doing good. So thank you for tuning in on us. And this is something that everybody doing orthodontics ought to know about, because these guys are running around over the country talking about correcting the TMJ problem. They showed 3 orthodontic cases in a row, and they just said orthodontics causes the jaw joint to hurt. It wasn't the orthodontics. She didn't hurt during the orthodontics, but when he took her out of the braces and put her in a retainer, he did not put a bite plate to keep it from deepening again. And on a deep bite case, every one of them would tend to deepen again when you turn them loose. I say every one, but nearly. So thank you for watching, and I'm going to sign off here.